Tonight's session, Mastering the Ultrasound, a Systemic Approach, is particularly specially because it features a remarkable collection of ultrasonographic images captured directly from Dr. Mathota's own clinical practice. This offers us a rare practical look at diagnostic excellence in an everyday setting. I want to emphasize few Zoom housekeeping rules. Before we begin, please observe the following guidelines to ensure a smooth session. I would like to urge you to stay muted during the sessions. Please keep your microphones muted through the presentation to avoid background noise. And screen etiquette, do not use Notion tools to write on the shared screen. The Q&A session will begin after the session is over. We encourage you to participate in the Q&A session, and please save your questions for the dedicated session at the end. Without further ado, please welcome Dr. Thushara Mathota. Dr. Thushara, it's over to you.
Okay, thank you, Dr. Yushika. So, welcome you all for the presentation. So, okay, today I'm going to talk about something about practical abdominal ultrasonography. Practically, what we can do with ultrasound machine. Actually, this is my objective today. I want to emphasize you how to do a complete abdominal ultrasound scan, because when you do ultrasound scan, you can do part by part. So I want to tell you how to do a complete abdominal ultrasound examination, then identifying normal organs. How do you identify normal organs? Then how to recognize abnormalities. I'll describe those abnormalities with images. Then there are some mistakes we all do. So we will discuss about those mistakes and how to avoid those mistakes. Then we can discuss how to improve the clinical decision using ultrasound. That's the main objective of today's presentation. So why do we use ultrasound? This is very important thing. This is non-invasive diagnostic techniques. Always we can use this diagnostic techniques without any damage to the animal, because it is not invasive. We can see images of the animal internal organs without any invasion. We can keep the probe on the surface of the body. We can see internal organs. Then ultrasonography, we can get immediate information. Actually, in ultrasonography, we get live images. We will see live images in ultrasonography. And this is repeatable. Always we can repeat ultrasound scan. If you do an ultrasound scan in the morning, evening also, you can do another scan and compare. Because this technology is not harmful to the patient. So we can always repeat and do the examination. There are useful cases in abdominal ultrasonography. I can just tell you if the patient is vomiting or if there's abdominal pain, sometimes weight loss, or then any urinary signs, we can do ultrasound scan. Then I will talk little about the machine, because the machine selection is very important to get optimized image. Because in ultrasonography, the image optimization is very important to get clear images and proper diagnostics. Preferred probe for abdominal ultrasonography, the microconvex probe. You can see here. This is the microconvex probe. Usually in small animal abdominal ultrasound scanning, we use this probe. Convex probe also we can use, but most of the time convex probe we use in little larger animal. If you have Great Dane or big Labrador, Rottweiler, like those dogs, we can use this convex probe. Otherwise, the microconvex probe is better. Then we have linear probe. The linear probe is used to see superficial organs because this linear probe, most of the time, those are high frequency probes. So with this high frequency, we can get high resolution images, but the penetration is poor. You can't see deep organs with this linear probe, but you will see very clear images of superficial organs. Sometimes we can use this to scan kidneys, spleen, like superficial organs. Then when we do abdominal ultrasonography, we have to consider about the frequency range. Normally, in this probe, we have frequency range. For dog abdominal ultrasonography, we use 5 to 8 megahertz range. That is the optimum range because if you go high frequency, the penetration is low. You can't see deep organs. If you go low frequency probe, in low frequency probe, the penetration is high, but the image resolution is low, then you can't recognize some abnormalities. Then for the cat, we can use high frequency probe because if the depth is maybe about 5 to 6 centimeters maximum. So you can use high frequency probe and get clear images. Then we talk about the machine. When we use ultrasound scanning machine, we have to know about these buttons, these settings of the machine. Always we'll have to change these settings to get optimum images. The image optimization is very important in ultrasound. Otherwise, you don't get diagnostic quality images. So first thing you will have to adjust is the depth. Depth means if you get this ultrasound scanning image, you have a scale here. On your left-hand side or right-hand side of the screen, depending on the machine, you have a scale. This is the centimeter scale. You can see how many centimeters you can see the ultrasound beam will penetrate. So you can adjust with this with your depth control. You have depth control button. So you have to decide what is the depth you want to see. Then we have gain control. The gain control means the overall gain of the image, the brightness. The brightness of the image will change with this gain control. If you want to change the overall gain of this image, you can see this image. If you want to see this image more brighter, you can increase the gain. If you want to see this image more darker, you can reduce the gain. But the next button is TGC. It is called time gain compensation. This is TGC. In this TGC, you can see here, this is the TGC control. The array of buttons is there. You can use this TGC control this TGC control to reduce or increase brightness at a specific depth. If you want to increase the brightness of the top layer, you can increase the top layer. If you want to increase the brightness of the bottom layer, you can increase the TGC control at the bottom layer. Depending on the requirement, you can adjust the time gain compensation and reduce or increase the brightness of the image of a specific region. That is very important to adjust the brightness because sometimes ultrasound doesn't penetrate equally. Some animals, ultrasound penetration is low. If the ultrasound penetration is low, the deeper organs get darker. When the deeper organs get darker, you can increase the brightness using this time gain compensation gradually. Then that is very important to get optimized image. Then all this machine, we can change the frequency. Sometimes on a screen controller, the control like this is available to control the frequency. So you can increase frequency or decrease frequency depending on the requirement. If your image, if you want more penetration, you can reduce the frequency. But if you reduce the frequency, your resolution is getting low. So you will see low resolution image. So If you want a high resolution image, you can increase the frequency and see clear images, but penetration low. Sometimes the bottom part of the image you can't see anything. Then the focus zone, there's a focus zone. In this all this ultrasound machine, there's an arrow here. You can see in this scale, you have arrow. This is the focal zone. So most of the time with the trackball or other rotating button, you can slide this focus point to top or bottom. So you can change the position of this focus point. This is the place where you get maximum lateral resolution. So the best quality image you will get here. I'm not going to describe more physics here, so I don't want to give you what is lateral resolution or those things. So maximum resolution you will get with this focal zone. Then you have orientation button. The orientation is very important in abdominal ultrasound because we always try to get standard images. When you get standard images, in abdominal ultrasonography, we use this pointer. This is the marker. This marker on our left-hand side in abdominal ultrasound. But if you go to do echocardiography, this marker is on other side. So we'll have to change the marker. So to change the marker, we have orientation button. Then we go to patient preparation. The patient preparation is very important in ultrasonography because our patients have the skin covered with this fur. Ultrasound cannot penetrate this fur. So if we want to penetrate ultrasound into the abdomen, we'll have to remove this fur. So shaving is very important. So we shave the abdomen. The area we shave, how do we identify? We can identify this area. We want to shave from sigmoid. You can palpate sigmoid cartilage here, just caudal to the sternum. Then we go up to the pubis. From sigmoid to pubis, then both sides flank at least halfway. If you are more used with your probe, you can do ultrasound scanning halfway shaving. But if you are new to do the ultrasound scanning, better go up to more than half of the flank area because then it's easy to find organs and sometimes get optimized images. Otherwise, you can play with this flexible skin and pull it and get images. Then fasting animal is sometimes we need fasting because the gas and the intestine and stomach sometimes disturb our views. So keep animal fasting, you will get better images. Consider about fasting if it is necessary. Because if you are trying to find retained testicle or something like that, or sometimes ovaries or something, then better to keep animal fasting and do the ultrasound scan. Then you will get better images. Then we can go to stress control. Because if the animal is severely panting or struggling on the table, we can't do ultrasound scan. It's very difficult because if it is shaking, if it is moving, the images are not good quality because it will shake the images. You can't keep the probe. That problem is there. So stress control also very important. So your table must be comfortable one and the environment must be comfortable one. Then patient positioning. Patient positioning, always we try to keep the animal on lateral recumbency because keeping dog on dorsal recumbency, it's not easy. If you keep the animal on dorsal recumbency and holding, it's more stressful to animal. But if you are keeping animal on lateral recumbency, it's easy. So I always prefer to do ultrasound scanning, keeping animal on right lateral recumbency. Then we turn the animal into left lateral recumbency if necessary. Some animals will have to go left lateral recumbency and find some organs. Otherwise, we can keep dorsal recumbency and do the ultrasound scan. But most of the time, you can do with right lateral recumbency. Then, scanning planes and handling is very important because when we do ultrasound scanning, we'll have to get standard images. When you get standard images, you'll have to know about these planes of the animal. And anatomical planes, you know these anatomical planes. So always we keep the probe on this anatomical plane. But some organs will have to go some oblique planes. That's depend on the requirement. But standard images, we'll try to keep the probe in these planes, and always we get the image, the marker is on cranial side of the animal. If the probe, if we keep the probe on sagittal plane or longitudinal plane, we try to get the marker always on the cranial side. If you are going transverse plane, we keep the marker on left side of the animal. That is the probe marker position. Then you will get the standard image. Then we have some probe movement. When we do ultrasound scanning, we'll have to do these probe movements. So first movement is sweep. Sweep means something like sweeping. You sweep the probe along the animal body. Then you can slide. Slide means you take the probe along the long axis of the probe. That's very easy, 2 movements. Then you have another 2 movements called pan and rock. Panning means you keep the probe on the animal body. This area is called footprint. It touches the animal body. So we keep the footprint on the animal body, then move the tail of the probe like this. You move the probe. So that is called panning. Then if you are moving it along the long axis of the probe, it is called rocking. Those 2 movements are very important to focus some organs. Then you can rotate probe clockwise or anti-clockwise. Those are very easy movements. Those are the 5 movements we talk about in ultrasound scan. Then when we do ultrasound scanning, it is better to do a ultrasound scan in systematic order. Then you don't miss any organs. So you can start with some organ. Some people used to start with liver. That is what I do. I will start scanning with liver, then go to spleen, kidney, then major vessels, then I find lymph nodes, then bladder, GI tract, and finally pancreas. That is the standard, easiest way to do ultrasound scan. Some people start this with bladder and start from caudally and they go cranial. But I am starting with cranial and then go caudally. Both way you can do, but always try to get systematic way. Then you don't miss any organs. Don't go and scan here and there. You first spleen, then kidney, then again you go to liver, like that. Don't mess up. Then we'll talk each and every organs here. First organ I do is liver. Normal liver, homogeneous. You can see this echo texture. It's homogeneous echo texture is there. When you keep the probe just caudal to the xiphoid cartilage and point the probe towards the shoulder, then you will see whole liver. When you see this liver, the echo texture is homogeneous. Then you'll have to compare this echogenicity, how bright this structure, with other organs, because looking at the screen, you can't see this is hyperechoic or hyperechoic. Because with your gain control, you can reduce the gain. So if you reduce the gain, it is hypoechoic. If you increase the gain, it is hypoechoic. So always you'll have to compare with the organs of the same animal. So you'll have to compare the echogenicity with spleen. So the liver is hypoechoic, darker to the spleen. Then you should have smooth margins then should not extend beyond the costal arch. If it is extending beyond the costal arch, it is called hepatomegaly. That's a hepatomegaly if it is extending beyond the costal arch. Then, this is the standard liver image I get. I keep the probe just coded to the sigmoid cartilage and I focus on left liver lobe here. When you focus on left liver lobe, you will see the diaphragm and this nice bright line. It is the diaphragm. You will see diaphragm. Then this diaphragm is, and you will see caudal border of the liver. So, if it is extending beyond the costal arch, you can see that this caudal border is not like this concave border. It will be convex. Now it is concave border. Sometimes it is convex if there's a hepatomegaly. Then we talk about liver abnormalities. What are the abnormalities we can see? First abnormality is hyperechoic. The echogenicity of the liver is higher than the normal. Then you will see hypoechoic. That is means reduced echogenicity. It's darker liver. Then you will see some nodules, masses, cysts, and sometimes you will see hepatomegaly or normal size liver, or sometimes microhepatic shrink liver. So we'll see that this is the hepatomegaly. Both images you will see hepatomegaly because the caudal border you can see this is convex. Here also caudal border convex. And this image you can see this image is darker compared to this image. So I can say this is hyperechoic, this is hypoechoic, but this is two different patients. So I can't say looking at this image. If I want to tell whether this image is hyperechoic or hypoechoic, I want to compare it with the spleen or renal cortex. We'll do that. This is how I compare it with renal cortex, because always right kidney is very closer to liver lobe. So you can go to see the right kidney. When you see the right kidney, this is the right kidney. The renal cortex of the right kidney is brighter than this liver lobe. That means this liver is hypoechoic, this renal cortex is hypoechoic. So here I can say this renal liver is hypoechoic to the renal cortex. That is how we compare the echogenicity of the liver. Then I compare this with spleen. When I compare with the spleen, sometimes in same image I can't get both these organs. So then I go to 2B mode of the ultrasound scanner. So you have this 2B mode. So you can get two different images either side of the screen. Then one image you have liver, another image you have spleen. Then I compare the echogenicity. Here I don't change the gain or I don't change the depth. Then I will compare these two echogenicities. Then here I can say this liver is hyperechoic compared to spleen. Normal liver should be hypoechoic. This is not normal then. So I can interpret it. This is not normal. This is hypoechoic liver. So like that we can compare it. Then sometimes you will get this type of liver. The shrink, irregular margins. The liver, I have keep the probe just coded to the sigmoid cartilage. You can see the this is the diaphragm. Here you have some ascites fluid and you have shrink liver. So this sometimes with liver fibrosis and sometimes with cirrhosis, you will get this type of liver lobes. Then with these abnormalities, we will have to interpret the finding with your clinical findings and other laboratory findings. If you don't have any other laboratory finding or clinical finding, the liver abnormalities, it's very difficult to give you a final diagnosis. I can say I have hyperechoic liver. Then when you talk about liver abnormalities, we can talk the diffuse abnormalities. The total liver is affected. Or you can talk about focal abnormalities. In focal abnormalities, you will see only one part of the liver is affected. Only one particular lobe is affected. Or sometimes you have nodule, or sometimes you have cyst. Those type of focal changes are there. In diffuse changes, we have these two. Here you have hepatomegaly, hyperechoic hepatomegaly, and hypoechoic hepatomegaly. Where do we get this hyperechoic hepatomegaly? In hyperechoic hepatomegaly, you will get in most of the time fatigue changes. In older animals, you will get this fatigue changes, sometimes steroid hepatopathy, or sometimes some fibrosis-like condition, you will get hyperechoic liver lobes. Sometimes in chronic hepatitis also you get hyperechoic liver. But most of the time in acute hepatitis and congested liver lobes, you will get hypoechoic liver lobes. Sometimes infiltrative disease condition also you will get hyperechoic or hypoechoic condition. So because of that, you can't give definitive diagnosis looking at hyperechoic liver or hypoechoic liver. So in this case, what you have to do is get sample from the liver using FNA. You can use insert a needle, ultrasound guided needle, and get FNA sample and do cytology. Then you can get specific diagnosis. Then this type, if you see this type of liver, this is damaged liver lobes, most of the time cirrhosis or some hepatic fibrosis is there. Then this is the microhepatica condition. This is so sometimes with cirrhosis. You can see this large gallbladder is there, but liver lobe is very small, shrink liver lobe is. Then this is there are number of nodules here. You can see this number of nodules are there in the liver parenchyma. This is nodular hyperplasia or some kind of disease is there in the liver. If you see multiple nodule like this may be nodular hyperplasia or some regenerative nodules. To get specific diagnosis, here also you'll have to do a FNA. If you see large single nodule, or if it is with calcification or something like that, it is most of the time cancerous condition. But here we can't confirm it. Sometimes this may be metastatic condition, but we can't confirm it looking at this image. So if you want to confirm, we'll have to go for FN. Then this is the standard image. You can't see it clearly, but here, if I show you this here, you can see something, some round structure. This is a liver lobe. It's high frequency, low frequency image because it's a little bigger animal. So here you can see this round structure, and middle you have hypoechoic center and hyperechoic surrounding area. This is called target sign. This is the typical appearance of liver metastasis lesion. If there's a liver metastasis or some type of cancer spreading in the liver, you can see this type of typical lesions. This is called target sign. Then we come to gallbladder. To see the gallbladder, you will have to focus the right liver lobe. On the left liver lobe, you don't see this gallbladder. So you'll have to fan the probe towards the right liver lobe. When you fan the probe towards the right liver lobe, you will see this gallbladder. The normal wall is thin wall. In dogs, you will see very thin wall in normal gallbladder. Then sometimes you will see sludge in older animals. In young animals, you don't see sludge. You see clear content like this. But when you go to the older animal, you will see sludge. But it is normal finding. Then you will see sometimes mucocele, dilated bile duct. Sometimes you will see cholecystitis. Sometimes you will see gallstone. Okay, this is a scanning image of animal. Here you will see some content inside the gallbladder. Actually, this is what I call sludge. This sludge is there inside the gallbladder. So this most of the time it is normal finding. Then when you come to this image, you will see something inside the gallbladder. So here the difference is you will see acoustic shadowing. Beyond this point in the surface, you will see bright hypercoic line here. Beyond that, you don't see anything. You see acoustic shadow. This is called acoustic shadow. So this is the typical sign of stone. If you find a stone inside the gallbladder, you can identify easily like this. You should see this acoustic shadow and bright line like this. Don't expect to see whole stone in ultrasound because the ultrasound doesn't penetrate through the stone. So we can't see whole stone. You will see only the surface. After that, you will see this acoustic shadow. So this is we use this acoustic shadow to identify the stone. This is gallstone. So you can easily diagnose this gallstone looking at this image. Then we come to spleen. When you come to spleen, homogeneous organ, the size actually subjective. You can't say you can measure the thickness of the spleen, the serosal surface to peripheral surface to internal surface, and this thickness you can measure some times if it is above 1.5 centimeter, you can say splenomegaly. But there are conditions most of the time when we do ultrasound scanning our dogs, we have splenomegaly. Echogenicity will have to compare with the liver. We have to compare the echogenicity with liver. A normal echogenicity is hyperechoic to liver. Then there are some abnormalities. You can find splenomegaly. In some, most of the time, tick fever or IMHA or any other diseases, inflammatory diseases, you will get splenomegaly. If the spleen goes beyond the midline, the tail of the spleen, I can say there's a splenomegaly. Otherwise, you can measure the thickness, and if it is above 1.5 to 1.7 centimeter, you can say there's a splenomegaly. Then you have nodules on the spleen. There are different type of nodules. Small nodules, sometimes there can be regenerative nodules on the spleen. It is not specific finds. You can measure the nodule size. If it is small nodule, maybe 0.5 centimeter, 1 centimeter, you can keep it like that and do another scanning after a few weeks, then compare the size. Sometimes those nodules can disappear. Sometimes those nodules can be the same size after few weeks. So some nodules will increase in size with the time. Sometimes when you see the spleen, you can see coarse echo pattern. Not like uniform homogeneous echo pattern. You will see heterogeneous echo pattern like this. Then if it is suspicious, we can't conclude whether there's something wrong or not. If you see this type of spleen, what we have to do is FNA. We'll have to do fine needle aspiration. But we'll have to be careful when we do FNA from the spleen, because if there's a bleeding tendency, we can't do FNA from spleen. So if you are doing FNA from, we have to do platelet count, sometimes clotting time. If everything is normal, we can do FNA from spleen and do the diagnosis. Then you will get this type of masses, cystic masses, and it's large size. Sometimes if you see this type of masses, most of the time cancerous growth. So those growth, sometimes you will see ascites fluid with this type of sometimes this can be hemangiosarcoma. So easily you can find this. If you see this type of masses, it's always cancerous growth. So here also you can do FNA and confirm. Then if you see this image, normal, earlier you saw normal spleen. But here spleen echo texture is completely different from normal spleen. Here you see black spleen with white dots. Here, this is the hilus of the spleen. This blood vessel is entering into the spleen. I have applied color Doppler. This is color Doppler window. In this color Doppler window, you don't see any color. That means there's no any blood flow in this blood vessel. So this is splenic torsion. In splenic torsion, you don't see blood flow to the spleen. This is the typical appearance of the spleen in splenic torsion. Sometimes this is called starry sky appearance. This black spleen with white dots. This is very easily we can identify. If you see spleen like this, most of the time it is a splenic torsion. Sometimes you will see a little blood supply with color Doppler. Sometimes you don't see blood supply like this. This is splenic torsion. Then we come to kidneys. Kidney, bean-shaped organ. You can see the bean shape in ultrasound scan. If you are going lateral side, you can easily see this bean-shaped organ. Then kidneys, it should be symmetric. And other thing is, when you do ultrasound scan of the kidney, you'll have to do both kidneys. You have to compare both kidneys. It should be in same size. If one kidney is bigger and one other kidney is small, then there's something wrong. So you can easily compare the size of both kidneys. Then sometimes you can measure the length of the kidney. But with the animal size in dogs, it's depend. Sometimes it can go 5 to 9 centimeters. So you can't give specific range because of depending on the size of the animal, it can change. But in cats, 3.5 to 4.5 centimeter in size. So you can measure the size in cat and say whether this is enlarged or not. But in dogs, it's a little bit difficult. But what we see is we will compare both kidneys. It should be the same size. Then we will see the renal cortex. This is around the kidney. You will see here renal cortex. Then you will see the medulla. Renal cortex and medulla. This is medium echogenicity. We tell the renal cortex has medium echogenicity. Then medulla, it has hypoechoic to renal cortex. Medulla is hypoechoic to renal cortex. Then there should be a clear distinction, with differentiation between these two cortex and medulla. You can identify clearly the differentiation, the difference between the echogenicity. Renal cortex is medium echogenic and this is hypoechoic. So you can identify. The distinction between cortex and medulla is very important in identifying renal diseases. Then the renal pelvis somewhere here. In normal kidneys, you can't see renal pelvis. Sometimes you will see a small line here, tiny line, but it is very difficult to identify in normal kidneys. So you can't see renal pelvis. And sometimes ureter also, it's very difficult to see in normal kidneys. Then you come to abnormal kidneys. When you come to abnormal kidneys, there are number of abnormal. So we'll talk one by one. This is in this image you have abnormal kidneys. Earlier I told you the echogenicity of the renal cortex and medulla. There should be clear distinction between the cortex and medulla. Here you can't identify the cortex and medulla clearly. So most of the time in CKD patient, you get this. The differentiation between the renal cortex and medulla is reduce distinction between renal cortex and medulla. Then this is called hydronephrosis. I told you in normal kidneys you can't see renal pelvis, but in this kidney you will see this black color center area. This is renal pelvis. This is called dilated renal pelvis. You can see dilated renal pelvis if this is called hydronephrosis. If there's a ureter obstruction in ureters or the blockade or some urine block, the back pressure leads to this condition. It is called dilated renal pelvis. You can see the renal pelvis here. Then, with the disease progress, this will increase here. This little somewhat dilated renal pelvis. This kidney, you have lost the cortex medullary distinction. There's no cortex medullary distinction in this kidney. Then the late stage, you will see like this. Severely dilated renal pelvis and reduced renal cortex and medulla. This is severe hydronephrosis condition. Then we come to urinary bladder. Urinary bladder, always we have thin wall less than 2 millimeter in when distended. Always when we see the urinary bladder, we'll have to see it in moderately distended bladder. The empty bladder, we can't assess the bladder wall thickness because in empty bladder wall is more thicker than normal bladder. So the lumen should be anechoic. The content of the bladder lumen should be anechoic. If you have some hypoechoic content, then there's something. But be careful when you interpret content in the bladder, because most of the time you will see artifact inside this bladder lumen. It is called side lobe artifact. You will get more ultrasound reflection from surrounding tissues. So maybe from colon or some other intestine loops, and you will get some artifact inside the bladder. You will interpret those things as some sediment inside the bladder. So be careful when you interpreting the content of the bladder. It should be anechoic lumen. Then you'll have to see abnormal bladder. What do we see in abdomen? We can see cystitis. You can see urolith. You can see blood clots or some tumors. You see some images. This is bladder wall thickness. I told you, in moderately filled bladder, the thickness should be less than 3 millimeter. Here, the thickness is 73 millimeter. This is 7.73 centimeter. This thick bladder wall. You get this type of bladder wall with cystitis. So easily you can diagnose cystitis. But here you don't see any content inside the bladder. This content is anechoic. Clear content is there. But bladder wall is thick. But see the bladder wall. This is smooth bladder wall. So you don't see any abnormal irregular surfaces. So definitely we can say this is cystitis condition. Then you will see this type of earlier we saw inside the gallbladder, the surface, bright surface, then we have acoustic shadow. This is uroliths. So you can easily identify uroliths. You will see bright surface and this acoustic shadow. Always this artifact, acoustic shadow artifact, is used to identify urolith. In this bladder, you will have sediment. With this sediment, you have acoustic shadow. That means here you have big stones. Here you have sediment, something like sand, tiny calcium. This is something on the floor of the bladder. This is tiny calculi. Easily we can identify these things with the help of this acoustic shadow and brighter surface. Then here also we have thick bladder wall. But in this bladder wall, it is thick, but thickness is very variable in the area and its inner surface is irregular. This is suspicious. This can be sometimes transitional cell carcinoma or something. So if you see something like this, here also we can do FNA, but it is very difficult. Because doing FNA from bladder, because this bladder wall is moving and the serosal surface is very uh, hard to penetrate. Insert the needle to this bladder wall, it's difficult, but we can do. Best thing to do FNA and get sample and send it for cytology and get the diagnosis. Then you'll see something like this inside the bladder. These are clots. Sometimes maybe blood clots or some protein accumulation. Some clots are there. So we can see this type of clots inside the bladder. So if you see this type of clot, we can catheterize and remove this, and sometimes we can do bladder wash or something like that. Then we come to prostate gland. When you come to prostate gland, it is caudal, always it is in the pelvic cavity. If it is young animal, always it is in the pelvic cavity. With the age, it get enlarged and it come into abdominal cavity. Then we can scan easily. But in young animal or neutered animal, it's very difficult. Castrated animal, it's very difficult to scan. You can see the length and height, and you can rotate the probe 90 degrees, and you can see the cross-section view. It's called butterfly view. You can see those butterfly. Prostate, most of the time you get benign prostatic hyperplasia. You will get enlarged prostate gland or prostatomegaly. Then you see prostatitis. You will see prostate abscesses. Like that changes, you can identify. Here, benign prostatic hyperplasia, you will see hyperechoic prostate gland and it's enlarged in size. That is, sometimes you will see small cyst like this. This is the urethra inside the prostate. Then you will see sometimes this type of cyst. If you see this type of cyst, we can insert needle and aspirate it and see the content. Sometimes there can be abscesses. Then you have prostatitis. In prostatitis also you have that type of abscesses and hypoechoic prostate gland, and it's always painful. When you keep the probe, when you try to scan, the pain is there. It's very difficult to scan if there's a prostatitis. Cause echo pattern is there. When there's prostatitis, the echo pattern is heterogeneous echo pattern. Then you get prostate abscesses like this. Inside the prostate, there are sometimes multiple abscesses, sometimes there might be some anechoic and hyperechoic content inside these abscesses. Then this is prostate gland. Inside the prostate gland, you can see this dilated urethra. You get this type of condition when there's urine blockage. Maybe you roll it or some problem. When there's a blockage in urinary tract, you will see the dilated urethra inside the prostate. That is something, not the abnormality of prostate, but the abnormality is somewhere else, but inside the prostate, you can see this. Then we come to uterus. Normal uterus, we can't see in ultrasound scan. It's very difficult. You can do, but all the animals, so if any stress animal, if you try to find uterus inside the abdomen, it's very difficult. You can't find it. But sometimes if the animal is in heat or if it is in stress, or if there's some condition like pyometra, mucometra, then you can easily identify the uterus. Here, an image of uterus. You can see bladder here. This is the bladder. You can see colon here. this colon, you have gas. Its superficial layer is there, this hypoechoic layer. Then you have acoustic shadow because of the gas. In between this colon and the bladder, you can see this round structure. This is the uterus. We can identify uterus, we can measure the diameter here. But always you can't do this. Some animals you can, some animals you can't. But if there's abnormality like this, always, most of the you know this, what is this? This is biometric condition. The fluid accumulated inside the uterus. The content is this little moderately echogenic fluid is there. This moderately echogenic fluid is there. Multiple loops are there. So you can see the content and you can see thin wall. Sometimes you will see thick wall. This is another condition. This tubular structure, the cross section, the longitudinal section, you can see the uterus, enlarged uterus, fluid accumulated. This is biometric condition. You can easily diagnose if you see this biometric condition. Then we come to pregnancy. In pregnancy, first thing you see is gestational sac. Normally, cat after 15 days, you can see this gestational sac. But in dog, you have to wait at least 21 days. After 21 days, you can see this gestational sac. So when you see this gestational sac, you will see the fetus inside the gestational sac. Sometimes it is not clear. If your ultrasound resolution is not enough, you don't see the inside content, but you will see the fetus and you will see the gestational sac. Then with the time, fetus will develop and then we can measure head diameter and body diameter. This is the best measurement we can do with fetus. We can measure this head diameter and body diameter and calculate the fetal age. But in dog, after 23 days, you can measure gestational sac diameter and calculate fetal age. Then after 25 to 27 days, you can measure crown to rump length, that is from head to tail length, and calculate the fetal age. Anyway, after 30-35 days, you can measure this body diameter and head diameter to calculate fetal age. That is the best measurement we can do in both dog and cat. We can give expected delivery date and fetal age. These are the formula. If someone if you have human ultrasound machine, if you can't do not have software in your machine, you can use this formula to calculate the fetal age. You can measure this length in centimeter and use this formula to calculate the fetal age. Then we come to stomach. Stomach is layered structure. It has multiple layers. It's called 5-layered wall is there. Then you can see the content, but if there's gas, you can't see anything inside. Here, the image, you have a superficial layer of the stomach. After that, you don't see anything. This is called dirty shadow of the gas. Because in the stomach, there's a gas inside the stomach. When there's a gas, beyond that, you don't see anything in ultrasound. So, always keep animal fasting. If you want to see whole stomach, we can give some water to drink and see the stomach. That is the very easiest way to see the stomach. Yeah, I told you this multi-layer structure. You can see 5 layers. You can see serosa. Then you can see muscularis. Then you can see submucosa, mucosa, and mucosal layer. Those are the layers of stomach. You can see 5 layers in ultrasound. All intestine also same, you will see these layers. This layered appearance is help us to identify these organs. And it is very important to see these layers because if there's some abnormality, if there's some ulcer, if there's some cancer, it will lose this layered appearance. So always we'll have to see this whether we have this layered appearance or not. And you have to go along this, follow this layer and see whether there are some abnormality in some places. Then you can, if you find this abnormality, you can identify some ulcers or you can some growths on the wall. Then we come to intestine. Intestine also you will have 5 layered. Here serosa, muscularis, submucosa, mucosa, then a luminal layer inside the lumen. The content is there. So you can identify those 5 layers. Normally, the wall thickness in the stomach also, the wall thickness in dogs should be less than 5 millimeter. In cat, it should be less than 3 millimeter. In the intestine also, the same, that this thickness of the wall should be less than 5 millimeter in dog, 3 millimeter in cats. Then very important thing is peristalsis. You can keep the probe on this intestine loop like this and see for peristalsis. Sometimes identifying, differentiating uterus from this intestine loops, it will help this peristalsis movement. Because if you see the uterus, it's a tubular structure like this, slightly enlarged uterus, it doesn't have peristalsis. But in intestine loops, if you keep the probe for maybe at least few seconds, maybe 30 seconds, you will see peristalsis. Then, I told you the loss of layered structure. You can see this loss of layers here. You have layered structure in this area. When you come here, you have lose these layers. Here, there are no layers. Here, there are no layers. Then again, it start layered appearance. So something there are lymph node enlargement or something here. Then, abnormal intestine loops, you can see loss of layers. Then you can see some obstruction, foreign body masses. This is very important thing. Here you can see multiple layers. I told you layer, the appearance is there. Now in the intestine loops, we talk about 5 layers. Here we have multiple layers. Why? Here you have something like the brown structure with multiple layers. This is called onion ring appearance, or sometimes it's called bull-eye appearance. This appearance is typical appearance of intestinal intersection. If you see intestinal intersection, this is cross section, this is longitudinal section. The multiple layers are there. You can identify these multiple layers in the intestinal intersection. This is a cat, so you can easily use high frequency probe and see this. Sometimes in dog also you will get intersection and you can easily identify with this typical appearance. Then sometimes we get this type of growth. Mesenteric lymph node, maybe growth from mesenteric lymph nodes or maybe growth from intestinal surface. You can't see sometimes origin, but you will see mixed echogenic heterogeneous growth. Like this. Sometimes you have clear margins, sometimes you don't have clear margins. So if you see this type of growth, we can do FNA here also, or you can go for surgical removal if there's no attachment to any other organ. When you describe this type of lesion, you have to see for attachment. If there's any attachment to any other organ, we can find going around this structure. Then you come to colon. The scanning colon is not easy because here you have the image of colon. It has gas. Beyond this superficial surface, this longitudinal section, you don't see anything. But in cross section, you can follow the colon maybe up to cecum, looking at the content and the surface. The fecal shadowings always disturb the vision. Then you come to pancreas. Scanning pancreas is an advanced technique. Always when you start ultrasound scanning, you can't do this because we can't see it. First, there's a technique you have to focus the right kidney. The easiest part of the pancreas is identifying the right limb of the pancreas. That is in between right kidney and the duodenum. This is the intestinal cord. You can identify the duodenum. In between right kidney and duodenum, you will see this hypoechoic structure. It is pancreatic tissue. You can identify it and you can measure the thickness of the pancreas. It should be 5 to 10 millimeter. If it is above that, and most of the time if there's a pain when you try to do the ultrasound scan of the pancreas, there should be a pancreatitis. Can be hypoechoic if there's a pancreatitis. Then you will see enlarged pancreas. The identifying right limb is easier. You can find the left limb. It's different technique is there, but it's a little bit difficult. But the easiest part is right. Then major vessels. Always we'll have to identify these major vessels. You can find aorta, abdominal aorta, portal vena cava, and portal vein. When you see aorta, this is most dorsal blood vessels. Structure, tubular structure, you can find most dorsally in the abdominal cavity. If you see cross-section, it's round cross-section is there in aorta. In normal ultrasound, B mode imaging, we can see pulsatile appearance. You can see pulses. Easily we can see pulses in abdominal aorta. In portal vena cava, you don't see pulses. In cross-section, you will see oval shape. Sometimes when you press the probe, the shape change in portal vena cava. Then portal vein, you'll have to go to the liver and identify the portal vein. That is the easiest place to identify the portal vein. In portal vein, it has bright wall. When you see the liver structure, it's easily you can identify it. Then, this is the caudal vena cava. In the liver lobes, you will see the caudal vena cava running through the liver lobe and it penetrates the diaphragm and it goes into the thoracic cavity. So, with respiration, the diameter of this caudal vena cava changes. You can see the diameter changes with the respiration. This is good place to see the hydration of the animal. If the animal is overhydration, it doesn't reduce the diameter with the respiration. If the animal is dehydrated, this diameter will reduce remarkably. You can see more than 70% will reduce if the animal is dehydrated. We can identify the hydration level. Here you will see this bright walled blood vessel. Here, this is the portal vein. With this, here you will see this bright spots in portal vein. Then abdominal lymph nodes. Sorry, I couldn't include the image for this. You will follow this blood vessels. When you follow these blood vessels caudally, you can go up to the bifurcation of the aorta to iliac arteries. Near that bifurcation, either side of this blood vessel, you will see subbiliac lymph nodes. You will find those subbiliac lymph nodes. If there's enlargement, you can easily identify those lymph nodes. So those are the most important lymph nodes we can identify inside the abdominal cavity. Then it can be reactive or neoplastic condition when there's an enlargement. Then when you do ultrasound scanning, common pitfalls. We have gas inside the abdomen. That is why we call this keeping animal fasting is very helpful to do abdominal ultrasound scan. I'm trying to see the right kidney. This is the right kidney. But there are some gas inside the duodenum or some intestine loops. It disturbs the vision. So this is the gas. So gas disturb my view. So better to reduce the amount of the gas. Sometimes we can change the recumbency of the animal, or we can change the probe location, probe position, and we can get clear images. Then poor contact. See this image. In this image, in this area, you will see dark because the probe doesn't contact properly. Sometimes I haven't put enough gel, or there might be some fur on the surface, or probe doesn't contact it properly. So you will see this black color here. That is another problem we get. Then depth adjustment and gain adjustment. Always you'll have to adjust the correct depth. I always tell you, when you want to see an abdominal organ, you will have to focus at least 2/3 of the screen should be the specific organ. If you want to see spleen, its spleen should be at least 2/3 of this screen. So you will have to adjust the depth and see. That is depth adjustment. Then other thing is gain adjustment. If your gain is too low, you will see dark images. If your gain is too high, you will see bright images. So it is not good quality interpretation. So normally it says you can keep the gain around 60%, but depending on the machine, it changes. Some machines you will have to go for higher gains to get clear images. Sometimes some machines you will get lower gain, you will get clear images. That's depend on the machine. So according to your machine, you will have to adjust the gain and get the images. Here, depth. I told you, if you want to see this spleen clearly, you will have to reduce the gain and get this spleen at least 2/3 of the screen. Then you will see more details. That is adjusting depth. Then when we talk about ultrasound scanning, we'll have to talk about a little bit of the artifact. There are some artifacts: shadowing, enhancement, reversion, mirror images, those things. So sometimes this artifact help us to do a diagnosis. Sometimes this artifact disturb us to get proper images. First thing is shadowing. This acoustic shadowing always help us to identify the calculi, uroliths and gallstone or some metallic parts inside the body cavities. It's very easy to identify those things with this acoustic shadow. This is called clear shadow. You will get clear shadow with some hard structures, maybe stones or maybe metal part or something like that. But if you have gas, you will get this type of artifact. This is called dirty shadow. This is common tail artifact or dirty shadow. So here you can identify gas. This is inside the stomach, you have gas. This shadow is help us to identify that. Then acoustic enhancement. This acoustic enhancement means you can see this is the liver lobe. You can see this gallbladder here. Beyond this gallbladder, the liver lobe is bright. This area you can see bright hyperechoic area. This area is hyperechoic compared to other liver lobes. This is called acoustic enhancement because of the fluid inside the gallbladder. When there's a fluid inside the gallbladder, you will get this type of acoustic enhancement. You will see brighter liver lobe here. This is not hyperechoic area. This is acoustic enhancement. You will have to we should know this artifact to interpret this. Otherwise, we will see this area of liver is brighter. This area is hyperechoic. No, this is not hyperechoic. This acoustic enhancement is there. Then you will see this reverberation artifact. This reverberation artifact is important to identify gas in the peritoneal cavity. if there's gas in the peritoneal cavity, when you keep the probe, you will see this type of parallel lines. This is the artifact we use to identify gas in the peritoneal cavity. This is used to identify the peritonitis. When there's peritonitis, there's a gas inside the peritoneal cavity. So with this gas in the peritoneal cavity, you will have to keep the probe on the top of the body surface and see for this gas. So you can identify and you can confirm that there's a gas inside the abdominal cavity, and you can confirm peritonitis condition. Then this head shadowing is another artifact. When you look at the luminal structure like this, you will get this head shadowing. This is another artifact. So there are a number of another artifacts. It will take more time to talk about those things. Then you will see mirror image. Here you will see liver lobe, left liver lobe. Here you will see the diaphragm. Via the diaphragm, you will see another liver, the same structure, liver-like structure. But normally it should be lungs here. You can't see lungs because this diaphragm and the air content in the lungs. So air content in the lung, and you can't see, ultrasound doesn't penetrate from that place, then you will get mirror image like this. This is called mirror image artifact. Then reporting. When you find something, you will have to report. When you write ultrasound reporting, you have to describe in this order. First, you will have to describe the location of the lesion. Then size. Echogenicity. The comparison, the echogenicity compared to some surrounding organ, hyperechoic or hyperechoic, moderately echogenic, like that. You will have to say the echogenicity of the structure. Then you will have to say the margins. Sometimes there might be smooth margin, sometimes there may be irregular margins, sometimes they are not, you can't identify the margin, like that. You have to describe the margins. Then effect on surrounding structures. It has displaced some organs, sometimes it has attached to the surrounding organs. So you'll have to describe those things when you report some lesions. These are the key take-home messages. First thing you'll have to practice, fixed order in ultrasound scan. You will have to start one specific organ. You just start from the liver, then you go around the kidneys, spleen, bladder, like that. Then intestines, major vessels. You should have a fixed order. Then you should know normal. First, you try to find the normal. Then when you find the normal, you see the organ, then you think whether this is normal or abnormal. If you find something abnormal, what is the abnormal? The echogenicity changes, size changes, or some margin changes, or you can describe those changes. Then you can change the window. If your image is not clear, you can change the window and get proper images. Then with all the finding, you will have to correlate it with clinical findings or other laboratory finding and get the diagnosis. Ultrasound alone, we can't get specific diagnosis. So when we do ultrasound scanning, we should know the clinical history or what's the indication for this scan. Then we can easily find the abnormality and get the proper diagnosis. Okay, thank you very much for listening me.
Thank you, everyone. And thank you, Dr. Mathota. If you have any questions, this is the time to ask the questions. And you can talk by unmuting your microphone, or you can type in the chat so we can forward the question to Dr. Mathota. Doctor, I do have a question. So
Yeah,
when we are doing these pregnancy scans, you mentioned that we do the measurements.
yeah.
So if you can just specifically tell us the head measurements where exactly the measurement has to be taken and the body measurements where exactly that will be helpful.
Yeah. Usually, body measurement, you get the cross section of the liver. You'll have to get nice round cross section across the liver. This is the place you have to get nice round cross section of the body. That is the body diameter. Then, when you measure the head, you get the diameter of the head on the skull. Skull, it should be symmetric. You can see the brain on the skull here. It should be symmetric view like this. Then you have to measure the diameter. That is the place you measure the head diameter. And usually you have to get the cross section of the liver for the body diameter. This is the two places we measure body diameter and head diameter. Then
Thank you.
earlier I told you this you can measure crown to rump length in sometimes maybe 25 days to 35 days fetuses. When you measure crown to rump length, you have to measure whole from end of the head to the tail. That is crown to rump length. Then sometimes you will measure gestational sac diameter. In early pregnancies, you can measure the gestational sac diameter. This is you don't include the uterus. When you measure the gestational sac diameter, you will measure from this inner border of the sac. When you measure the head diameter, you will get the symmetric head like this. Always try to get this view and measure the diameter from this point to this point.
Thank you, Doctor. And there is a question from the crowd. Dr. Ajit is asking whether you can elaborate on ultrasonography of the chronic kidney disease cases.
Sorry?
If you could elaborate the
Yeah.
ultrasonography of the chronic kidney disease cases.
Yeah, in chronic kidney disease, most of the time I told you, can show you that you will lose this cortical medullary distinction. You don't see cortex, the difference between cortex and medulla. The renal cortex should be hypoechoic to medulla. Medulla should be hypoechoic. But the difference you don't see. Sometimes you will see hyperechoic renal cortex. The renal cortex is moderately echogenic. It is not hyperechoic. So in chronic kidney disease, you will see hyperechoic renal cortex. Sometimes we measure the ratio, cortex to medulla ratio. This cortex to medulla ratio is usually 1:1 ratio. Sometimes when there's a chronic kidney disease, this cortex reduces. You can see reduced cortex medulla ratio in chronic kidney disease. Those are the findings you will see in CKD. But along ultrasound, you can't diagnose. You'll have to go for creatinine ellipsos or SDMA ellipsos or some other measurement to confirm the chronic kidney disease. But if you see this type of kidney, you can confirm this as a chronic kidney disease.
Do you have any questions? You can unmute your microphone and ask directly, or you can type in the chat box.
Doctor, can you just show, is it possible to show some more figures of scanning views of the pyometric cases in different animals?
Different animals is dogs.
Dogs and cats.
Here I have included only two, I think two. Actually, identifying pyometra is very easy. You can identify the bladder. Usually dorsal to bladder, you can see this type of tubular structure, fluid-filled structure. It's very easily you can identify. But if the larger pyometra condition, you will see this type of fluid-filled structures. when you keep the probe, you will see this type of cystic structures inside the abdomen. Then you can identify it easily. The content of this fluid is moderately echogenic. But if you see anechoic content, completely anechoic content, you will have to see the walls of the uterus. Sometimes if the walls of the uterus is thin, it can be mucometra condition. In biometric condition, it should be echogenic fluid and the wall should be thick. Thin walls, if you see anechoic content, it can be mucometra. So you can measure the diameter of these uterine loops. And that's how you identify the biometric condition.
Any scenery of mummified fetus? You have any scan report?
Mummified fetus, actually, I didn't include here. I have thousands of images. It's very difficult to find from now. I can't find, I think.
It's okay, doctor. Thank you. It's very good and brief, nice presentation, doctor. Thanks.
There is another question from Dr. Shiv. He's asking if you can show the ovary of the dog and cat.
Actually, it's normal. You can't see normal ovaries because in an estrus animal, if you try to see the normal ovaries, it's very difficult. You will have to have high frequency linear probes at the caudal to kidneys. Caudal pole of the kidney, you can find ovaries, but it's very difficult. But if there's a cyst, maybe ovarian cyst or some other type of cyst in the ovaries, you can easily identify. I have images with the cyst, but in this presentation, I didn't include it. So now at the moment, I can't find it.
Okay. Also, doctor, there's another question from Guru Simran Singh. Doctor, what is the fastest abdominal scanning protocol?
That he's asking about AFAST or?
I think so.
I think the AFAST protocol means that it's in AFAST you are going to find the fluid inside that dome. When there's a fluid, we have a scoring system in AFAST. You give a score from 1 to 4. So you can give the score. Here you find whether there's a fluid near the liver and caudally near the bladder and near the spleen and right kidney. We scan those 4 places, and if there's a fluid, you give 0 to, if there's no fluid, you give 0. If there's a moderate amount of fluid, you give half, and if there's fluid, you give 1. Then you collect those score and you give abdominal fluid score. Then you can, that is the AFAST scanning. Usually we do AFAST scanning to see whether there's any fluid inside the abdomen or not. Just to assess sometimes there may be bleeding or some abdominal bladder rupture or any other conditions.
Okay, thank you, doctor. And there's another question from Dr. Purni. She's asking whether do we have to do echogenic comparison in all the organs, because if there is abnormalities in both the organs, which changes the echogenicity in both, how do we express echogenicity in them?
Yes, you have to do that. Because normally, if you have, when you do the ultrasound scanning, always we are comparing all the organs because comparing kidney to liver, we can't say the liver is hyperechoic or kidney renal cortex is hyperechoic. So again, you'll have to compare with the spleen also. Then usually we compare the echogenicity with surrounding fat also, because the echogenicity of the surrounding fat always, when you do ultrasound scanning of the kidney, you can see surrounding fat echogenicity is almost isoechoic to renal cortex and those organs. So always try to compare with those echogenicities, otherwise you can't say, because sometimes you get very hyperechoic surrounding fat in peritonitis condition or some other infection. So you can easily identify, you can compare with other organs. So always when you do ultrasound scanning, just looking at the screen, we can't say echogenicity. You always compare all the organs of the same animal. That's how we give the echogenicity. Main organs we compare renal cortex, liver, and spleen. Those are the homogeneous organs. Easily we can see echogenicity. There's no other organ in intestine loops. You can't. There's no place to compare the echogenicity. In bladder wall, you can't compare the echogenicity. But those organs you can compare echogenicity. Always we have to compare those three organs, whether there's any changes. In prostate also same. You have to compare with the other organs. Otherwise, you can't say this hyperechoic or hypoechoic.
Okay. Thank you, doctor. So there's another question about how to differentiate anechoic from hypoechoic.
Anechoic means fluid. There's no any echoes. It's like it's this black like this. Hypoechoic means always you are comparing with other organ. If you are telling spleen is hypoechoic, you'll have to compare it with liver. Spleen is hypoechoic to liver. Or if you can say liver is hyperechoic to spleen. Like that. You'll have to compare with other organ. Anechoic means there's no any echo. It's black color.
Okay. And there's another question. Can we see adrenal gland in normal conditions? If in a case like adrenal-dependent hyperadrenocorticism, how can we recognize the gland's abnormalities?
Yes, you can. All the animals, if you use high frequency probe, that's a technique with the you can identify adrenal. You can measure the size of the adrenal glands. You can see whether there's any abnormalities of the. This is basic scanning. I didn't talk about adrenal gland. If you want to do the ultrasound scanning of the adrenal gland, you'll have to focus the kidney, and you'll have to find the renal artery near the. Usually, you get abdominal aorta. Near the abdominal aorta, you will see the renal artery. Then there's a triangle in between renal artery and abdominal aorta. In that place, that is the location of adrenal gland. You will find the adrenal gland at that location. When you focus the adrenal gland, you can measure the size of the adrenal gland. Then you can see whether there's any nodules or any symmetrical abnormality or any abnormalities of the adrenal gland. But if you are doing basic abdominal scan, I advise you not to don't try to do adrenal gland because it's very difficult. First, practice with normal basic abdominal scanning. Then you can do adrenal gland scanning. But if you want to do adrenal gland scanning, you should have high frequency probe. And your hand should be more stable to keep without moving the adrenal gland from the screen.
Thank you, doctor. So there is another question about intersusception and volvulus. As we already spoke about intersusception, I think we can ask the question about volvulus, how to diagnose it through ultrasonography.
Yeah, actually both same. You can normally, if you see intersusception, it's an emergency condition, we'll have to go for surgery. In volvulus also, you can see some gas or some other things. The ultrasonography completely, we can't give a specific diagnosis in volvulus. You can't see intersusception.
Okay. Doctor, also they're asking about the differentiation of intestines from stages of pyometra. I think we have answered to that
I think I
already.
gave the answer. You can see
Yes.
for the peristalsis and layers. Because in intestine you have 5-layered structure. In uterus you have usually you have 3 layers. Most of the time better to see the peristalsis. It's easy because that's the thing. If you have high frequency probe, you can see those layers. Otherwise, with basic ultrasound, if you have a basic ultrasound scanner, you can't see the layers. So you'll have to see the peristalsis.
Right. I think we'll just finish with one more question. So Dr. Guru Simran Singh is asking whether how to measure LVP in ascites.
Sorry?
LVP. I'm not too sure what that stands for. How to measure LVP. Maybe if you can forward the long version of LVP, then that'll be helpful. Okay. And Dr. Janiti is asking, what's the earliest time to diagnose pregnancy in dogs and cats?
I told that usually in dogs, we have to wait till about 20-21 days. And cats, you can see after 17 days, you can see the gestational sac.
All right. So I think that'll be all. Thank you so much, Dr. Mathota, for this informative presentation. And I really appreciate taking time out of your schedule and giving this nice presentation. And I think there's a lots of appreciations coming to you through the chat box. So we will conclude today's session. I would like to invite Dr. Sugat Premachandra to floor to conclude the session and do the vote of thanks.
Thank you very much. Yeah, thank you very much, Dr. Mathota, for your productive and very informative presentation. And also, I want to thank the participants and our moderator, Dr. Ishika. And we saw a lot of interactions with the participants today for the webinar. Really happy and very proud because we are doing this webinar series not only for Sri Lankans, it is for overall veterinarian in the world. We can see some doctors overseas are looking from our YouTube channel, more than 20-25 views from that as well. Thank you very much, Dr. Mathota, for your informative and very creative presentation. Easy method for understanding the images of ultrasonography. Thank you, Dr. Mathota, once again for your clear presentation on behalf of SLVA. And thank you very much, Dr. Ishika, for your moderation as always. Thank you very much. And thank you for all the participants. Thank you. Good night.
Night.